Hello friends, today we are going to discuss managing acute conditions with homeopathy. Before I discuss this and start the discussion about managing acutes, I would like to share my experience how I came towards managing acutes in homeopathy. It was my second year in medicine and somebody comes and knocks my door saying that is there a doctor in, and my mother wakes me up saying that there is an emergency outside. So I told her, but I am not even a doctor. She said, no, but they are waiting for you. I go outside to check out, and there is a young lady standing there asking me to come and see her daughter who has been vomiting. I tried to explain her that I am just a second year student and I may not know much, but she says, you are in medical school, you have to come and see. I said, I can, but I may not be able to treat her. She says, no, there is no doctor available. At least you will give a better advice than what we couldn't do. So reluctantly though, I go. I, in half sleep, listen to all her complaints and advise her some remedy which I knew, those 4 or 5 homeopathic remedies at that time. And come home, sleep very nicely, not even thinking what must have happened to the patient. Next day morning, to my surprise, the mother comes and tells that she is better. I don't know what happened and what the remedy was indicated, but this was the first beginning. There onwards, when I went into a homeopathic school, managing acutes were something which most of the teachers were reluctant to teach, or if they were teaching, they were asking us to refer books. But the available knowledge was not that very cleanly available at that time when we were learning homeopathy. I had been attending many seminars, many schools of homeopathy, but nobody taught us clearly that this is the way that you treat acutes. Out of falling many times and failing and learning, this is something which I have gathered, which I am planning to share with you. So what is an acute disease? Aphorism 72 of Gajanan says that disease to which a man is liable are either rapid morbid processes of abnormally deranged vital force which have a tendency to finish their course more or less quickly but always in a moderate time. These are termed as acute diseases. Now, this is the definition. We all in our clinics are encountering lot of acute illnesses day in and day out. In fact, it forms in India around 60% of our practices. Now, how to encounter these acute diseases? What are the prerequisites of treating acutes? What I first believe is you need to look at the cases with a different perspective. We have been taught to follow a system. So, we get dogmatized by seeing all patients in the same way. Suppose we are a follower of a particular system. Whatever the patient complains, we try to see the patient in the same perspective in which we are. When Dr. Hahnemann writes that we need to be an unprejudiced observer, he means that we don't even carry any system with us. Patient does not decide the system. We decide the system depending on what the patient is complaining. Now, we in homeopathy used to believe that diagnosis is not important for us. We treat the patient as a whole. But when you are treating any acute diseases, the first and the most important thing is that we know what we are treating. If we do not know what we are treating, it is very difficult for us to gauge the prognosis of the patient. Many cases have gone to a worse prognosis because the homeopaths did not know what he was treating. For example, a patient having a pneumonia and you are treating thinking that it is a chest congestion. The disease proceeds very rapidly. If the remedy which we are choosing does not match the pace of the disease, the remedy will be not suiting the need of the patient. So, in all cases, if you do not know what the diagnosis is, kindly share it with your allopathic colleagues or send it to laboratory investigations, but please know what you are treating. The another most important aspect of homeopathy and a skilled homeopath is observations. There is a whole chapter on observations and what to observe. But friends, if you develop this skill of observing a patient, observing what he does, observing what you see, and how to convert into homeopathic language and the repertory language, there is no better comparison to that skill in homeopathy. The third point after acute observation is careful questioning. When a patient comes in an acute problem, especially children, the patient is fully accompanied with his anxieties, his worries. So, when he is relating the problem, he is relating his anxieties and worries first, especially a mother carrying a small child. She will be telling you he has fever and the fever went to 101 and then we gave this and then this happened and then we had this much feed and then he vomited, and she gives you a whole story of what things have been happening to her rather than what is happening to the child. But if we are focused on asking what is happening to the child or to the patient since the time he is not well, that will help us come to the remedy faster rather than getting emotionally involved with the patient. So the questions should be directed towards understanding the patient in the problem rather than understanding the mother's anxiety or the relatives' worries. Second, fourth most important aspect is examination. Examination and examination tables in homeopathic clinics have been obscured. Some people do not examine a patient thoroughly. But examination is as important as choosing any good rubric in homeopathy. Most of the rubrics in acute illnesses can be found by detailed examination from top to bottom. In my clinic, I try and examine and touch the patient from top to bottom in case he is in acute illness. For example, a case of fever. A small child of 3 months old has been brought to you for fever, and he comes with his attendant. The patient's attendant doesn't know what to tell about the fever. So where will you find the findings? It is on examination. Which part of the body is hot, which part of the body is cold, which part of the body sweats, which part of the body does not sweat. If you touch the body from top to bottom, for example, if a child, especially in case of fevers, a small child has been brought to you and the child has fever. The child has come with an attendant, not the parents, and you have to be sure when you are prescribing. If you ask the mother, the attendant, what the problem is, the attendant will tell you it is fever. Then you ask in detail, since when? Since I came to work. Tell me more what he has had yesterday. I don't know, sir. So in these cases, when the history is very lacking, you have to depend on what you see. So the first important skill that comes is observation, and second is examination. So after observing the child in the problem, when you touch the patient, you come to know which part of the body is hot and which part is cold. These are those hardcore facts which do not change. If the child has the head warm and the legs cold, or the upper part of the body warm and the lower part of the body cold, the remedies can be shortlisted faster. Then, what is the thing that makes the child feel better? When the patient has a problem, what the mother or the attendant does to make the child feel better is the last rubric in the case, and this will help you to come to the remedy. So, examination forms a very important aspect in treating acute illnesses, especially for those patients who do not speak. For example, a patient in coma, and you go to see in a hospital, the patient is already on a respirator, and you have to ask a history to a person who doesn't know it. Some examination findings like movement of one eye, the tongue flickering, or not responding to verbal commands, responding only to deep stimulus, one side of the body hot, one side of the body cold. So these are the findings which will anchor you in the case, and in such cases anchoring is very, very important. Now what is anchoring? Anchoring is where you are sure and firm about, and it is very important that you need to be firm in a case when we go ahead in understanding the remedy. We all collect fantastic information, we all collect everything that is given in the patient, but the problem is how to analyze and what is the thing that we need to give importance to. So what is analysis? Analyzing a case is equally important as case taking. For example, if you have taken the case completely and do not know what is to be prioritized when you analyze, then the case taking does not serve the purpose. So what has to be prioritized when you are analyzing is an art which we will learn as we go ahead in the cases. Another important aspect is repertory and materia medica. It is very important for us as homeopaths to have an equal knowledge of repertory and materia medica. Now what is most important in knowing the repertory and materia medica is to know the clinical materia medica. That helps in acute management the most. Clinical materia medica means books like Dr. Borig, Allen's, Dr. Fatak's, N.M. Chaudhary's, Clark, where the medicines which have been written have been clinically proved by different homeopaths all around the world and have had successful results with it. So whatever the patient says, if it is evaluated by the clinical materia medica and analyzed by taking proper rubrics, the chances of you coming to a right remedy in the first attempt itself becomes higher. Okay. So now if you revise, what are the requisites in treating acutes? The first one is proper diagnosis, the second is acute observation, the third is proper questioning, the fourth is detailed examination of the person, fifth is proper analysis, and sixth is repertory and materia medica. So now how to proceed in case taking in acutes? What I firmly believe, if we have to treat acutes, is that we have a good conviction. Now what is the conviction? This is something which I have verified in my practice time and again, and every day when I go to my clinic and every day when I see patient, I am looking for this single thing. That is what Dr. Hahnemann writes in aphorism 153. The most striking, singular, uncommon and peculiar characteristics, signs and symptoms of the disease are chiefly and most solely to be kept in view when we are treating a patient. What do you mean by this? I have found it n number of times that in any illness, may it be in acute or may it be in chronic, every patient does something which is so very illogical, so very uncommon. It may be as a presenting symptom or as a compensating symptom or maybe as a concomitant, which generally indicate his uniqueness. Till the time you don't find the uniqueness, the case taking does not stop. It can be a symptom, it can be a concomitant, it can be a feature of him, it can be his nature, it can be the adaptive mechanism, it can be a sensation, anything. So when you sit in front of a patient, the first thing that you should be convinced about, that the patient is going to have something very peculiar which we need to see. Now we generally get bogged down with general symptoms, because when our patient is in acute condition, lot of patients or most of them will be complaining of something which is very common. For example, when it's fever, he will be talking about his fever. When he is having fever, he will be talking about his appetite, which is very common that he may not have an appetite. He may be weak, he may be restless, he may be having a headache. The common symptoms during the problem have to be eliminated. they have to be considered only after you find something which is very peculiar, something which is very unique, something which is very individualistic. A person who practices homeopathy believes in two important principles, which I have learned from Dr. Rajan Shankaran and most of the teachers around the world. Homeopathy works on two main principles. One is individualization and second is generalization. A person who individualizes is a homeopath and the person who doesn't is not. Individualization can take place at any level. It can be at the level of the pathology, it can be at the level of at a peculiar symptom, at the level of concomitant, at the level of keynote, at the level of his nature, at the level of his sensation. It can occur everywhere, but it should be corroborated with generalization. If we can do this, then we will be successful in majority of our cases. The common symptoms which are observed in almost all diseases and which are common to those diseases should be kept at bay when we are seeing any acute or any chronic diseases. As we go ahead with this lecture, I am going to discuss every aspect of managing an acute case. Like I told you about case taking, like I told you about understanding a peculiar symptom, equally important is to understand a cause. When we are seeing a patient, sometimes we forget or don't try to ask what the cause is. But when I see any acute case, I believe in one more important thing is the cause and the change after that. So it can be a exposure to rain and a change after that. It can be an emotion and a change after that. So the cause is very, very important to understand what is the thing that triggered the present situation. So it can be an exposure to a particular allergen, it can be an infective process, it can be an emotion, it can be a weather change, it can be anything. So always spend at least some 5, 10 to 15 minutes understanding the cause of the disease or since when he is not well. You may have an immediate cause or you may have a cause in the past. We have so many rubrics which says not well since, like for example not well since pneumonia or not well since typhoid or not well since menses, and we go on treating patients seeing the presenting symptoms and it gives temporary relief. Why it is that it gets temporary relief? Because the cause was never considered, and the moment you consider the cause and prescribe, the patient is better for a long time. You can go to any level to understand the cause. As we go ahead in the cases, we will be discussing the causative factors at length in different cases, in acutes as well as in those cases where there are a lot of recurrences, and how a good prescription failed by not understanding the cause, and when the cause was understood properly, the same prescription did wonders to him. An acute disease has an exciting cause. It comes suddenly, has a rapid course and ends in a death or a recovery. Usually an acute disease and the exciting factor, for example a psychological, physical, biological or a chemical factor, go ahead, cause a change in the human physiology. I would always see the cause in the following factors: either the mental, the physical, the physiological or pathological. The moment I see a mental change after a cause, then I know the evaluation of mental aspect is the most important thing in a case. For example, a patient comes with a severe pathological problem and he says, "Sir, I am extremely worried about this and I don't know what will happen to me and I don't know what is going to, how this thing is going to turn out to be. I am in terrible pain, but my neighbor got a problem and he also had a similar symptom." And you know what is happening now? The patient is talking about his state. Here the cause is the pathology, but the effect is on his psychic, on his nature. So the presenting symptom on his nature will be given the most important weightage when I am going to treat this case. Another example, which is common in the Indian subcontinent. It is like in the change of seasons, or when a patient gets wet suddenly in rainy season. What do you see? The patient comes with a flowing nose, coryza, cold and fever. Now what happened to him? When it was a bright sunny day, I was walking on the street, I suddenly had to get wet because I forgot the umbrella. Since there was a short distance, I decided to walk. I kept on walking for half an hour or so. I had drenched completely, went home, cleaned myself, and by evening I got fever. So tell me, what happened in your fever? And it says it is flowing nose, watering of eyes, nose block, and this chills, and I am not able to bear anything. I have to hold myself, and the whole of my body is shivering. So if you see that after getting wet, what was the first thing that happened to him? The first thing that happened was, after getting wet, his nose started leaking. Then there was watering of eyes. Then he had chills. So what was the change? The change was on the mucous membranes. All the mucous membranes started secreting the secretions. Now because of this, the patient falls sick. Now what is unique to him is the physiological change. So what is the thing that I had to give importance to is the physiological change that occurs after the causative factor. And we know the remedy. One of the remedies is Dhalkamara. Then Dhalkamara belongs to the family Solanaceae. And what is the theme of Solanaceae? Violence. Just confirm it with the violence and your remedy is there to treat the patient. Another important aspect is about location. We have been learning this in school, that always take the location, the sensation, the modality, the concomitants. We all do it, but many a times we fail to use it when we really need it to be used. Now, how to understand when to give importance to what? Location becomes very important in a case when a body chooses to show a symptom on a peculiar and a particular side. Whenever I am seeing a case, for example, a case which has a one-sided presentation, the thinking process is the body chose itself to manifest at this spot. The disease is somewhere inside, but since it has been chosen to be on this side, it becomes peculiar for me unless and until proved otherwise. If the location, you can't take a location of right sided for a patient having an appendicular pain because it has to be right sided. Such obvious sensations are generally to be omitted. But if you see a location at the corners of the lips. So now we come to another important aspect in treating acute illnesses, that is the importance of location, the sensation, the modality and the concomitants. This has been sometimes given very less importance.